So we're just sort of waiting to make sure that we get everyone on the line here. So we're just going to give it another minute or so, and then we'll get everything going and we'll get the webinar started. Thank you. Alrighty, everyone. So it's just a couple of minutes after 1 o'clock, so I think we're going to get things started. So again, my name is Hala Combian, and I'd just like to welcome you all to the eHealth Innovations Catalyst Grant webinar. So for today's presentation, speaking as your host today, we'll have Dr. who is the Scientific Director of the CIHR Institute of Health Services and Policy Research. We will also have some representatives from Program Delivery at CIHR, Mary Fraser-Valquette, as well as Michelle Peel from the Institute of Aging. And then finally with us, we will have Fernando Santiago joining us from the Center. All right, so just a few notes about this webinar. I would like to let everyone know that we are planning on recording this session so that it can hopefully be made available offline for you and others to view in the future. So we are expecting quite a few people on the line today, so I think it will be easier for everyone if I explain how we will proceed. All right, so first, just taking a look at your screen, you have the presentation screen where you can see the slides that I have to share with you. Just outside the presentation are the panels. So the buttons at the top can help you decide which panel you see in that area. On the participants panel, you'll have access to feedback buttons and the area where we'll conduct our short poll at the end of the webinar. You can also use the chat panel to communicate with us. So using chat, you can direct questions to us, and you can simply send us your comments. So it's possible that the chat panel might disappear, and if this is the case, then you can just simply click chat at the top to bring it back again. And if you find that the presentation isn't showing big enough on your screen, then you can click the Zoom button that's in the Fit to View Finder at the bottom left-hand side of your screen. Okay. So what we've decided to do for this webinar is that everyone who's not a part of the panel, so all of you participants, we've put everyone on mute just so that there aren't too many voices going around, and that way just to sort of control things a little bit better. So again, we do encourage you to submit your questions through the chat function, and all the pertinent questions we will leave until the end of the webinar, and we will cover those during our Q&A session, where you'll all have an opportunity to sort of ask any lingering questions or last-minute details. So right now, I'm about to hand the mic over to Dr. Robin Tamblyn, who will continue to lead the webinar. And again, just wanted to thank everyone for taking time out of your day to join us. All right, thank you.
Good afternoon, everyone. This is Robin Tamblyn, and thanks, Howard, for the intro, and hopefully everybody can navigate through the webinar effectively. I just wanted to let you know we've been asking people as they've registered for the webinar about who they are, and you can see the majority of people who are attending today are academic. We have a from industry and a few people who are either end users or knowledge users. And also, if we look at sort of who's participating, this is quite delightful, actually. It's the first time I've seen all 4 pillars participating in a Catalyst opportunity, so we're really thrilled about that. So just to get down to what our plans are for today, first of all, and you'll see the list of things that we're going to cover on the agenda. In preparing the webinar and with the funding announcement that's now up on the CIHR website, we have been getting questions from people, and some of these questions we will, with each of these areas, what is the catalyst, relevant research areas and funds available and industry partners and so on, is that I'll highlight some of the questions that have been asked and answered so that at least everybody will share in that information at the get-go. So the first question is, what is the e-Health Innovation Catalyst Grant? These Catalyst grants, by the way, are used in an area where there's been less work done. We're using it to try to build capacity in the community to respond to larger funding opportunities. So as we speak, we are planning a larger family of funding opportunities that will leverage essentially some of the partnerships and things that have already been hopefully get underway in response to the Catalyst grants. Whether you're funded or not, I'd like you to see this as an opportunity to really lay some structural groundwork that will help you with all these future funding opportunities that are coming in the next year or so. First, the first thing I want to outline is that there are many things that we could support along the continuum after engaging with the ministry partners and with the research community and with the industry, is that we've actually focused this particular catalyst on the part of the continuum which is in the integration and evaluation of current e-health approaches in one of the following 5 areas. The first is in patient-centered e-health. The second is in a new generation of health professional decision support to support individualized patient care. The third area is in population health monitoring to facilitate timely detection and intervention. And the fourth area is on integrated solutions to support the continuum of care, patient-centered care, patient self-management to clinical team support to population-based monitoring, and finally approaches, e-health approaches that could be integrated or in place already to strengthen and improve equitable access to care. So those are the 5 areas that are fairly broad areas. I think you probably will find yourself fitting into those areas, one or more of them, which would be a good thing for this initiative. The second thing I want to focus on, objective of this, is to evaluate the cost, as I mentioned, ideally comparative cost of the care the usual way versus through new integrated e-health solutions, and one of the domains of quality. At any one of the quality frameworks, there's one at CPSI, one for the Institute of Medicine, but generally they cover the following areas: effectiveness, efficiency, equity, patient-centeredness, safety, and timeliness. So you can pick one or more of those domains of quality, but we wanted to highlight that this is where there's a bit of a desert in terms of research findings, and these are necessary to move forward on the policy front. The third bullet is really lessons learned from all previous efforts, and that is that we need to incorporate end users, the people who would actually be using the actual integrated or single dimension technology that we're wanting to evaluate into the evaluation process. This is a must and a requirement for this initiative. And finally, we wanted to use this to foster the establishment of partnerships that would yield individual programs, researchers, and industry. So catalysts are really seen as a way of helping people get together who might not normally have gotten together to support this kind of new initiative. And again, I'd like to reiterate, we see this as foundations for upcoming more extensive family of funding programs. So in this particular initiative, the partners that have signed on at the get-go, it doesn't mean that others can't join later, but the partners at the beginning are our institute, the Institute for Health Services and Policy Research, the Institute of Aging, who sees that e-health solutions will be very important in the future for their seniors community, and the International Development Research Center, or IDRC. As I mentioned, these are the 5 areas. There are 5 relevant areas of research. And so patient-centered e-health, and I'm going to go through each of them in turn. One of the questions that's been asked, maybe this may be not the most appropriate time to raise this question, but whether or not qualitative research studies will be considered in this initiative. And the answer is, of course, yes. But they would likely be a complement to other methods as well, because both cost and quality are things that will need to be evaluated in this initiative. So just settling down into sort of what are we expecting, or sort of what's the scope, and it's not to say these are just examples to get your engine, your intellectual engine going. So in the area of patient-centered e-health, a fantastic area of, sorry, I shouldn't have progressed that quickly through it, but let me just highlight, because there's no backward button, sorry folks. So examples in this are really lots of things that are out there which potentially could be integrated into self-supported management solutions for improving the management of chronic conditions. We're seeing really some exciting things in this area that potentially could change both access and quality of care on the ground, improved efficiency or expanded access to care through patient-centered self-management e-health solutions, and integrated self-management tools that would link essentially patients through a variety of different telecommunication mechanisms with their care team. So we see really some exciting areas. I think you probably yourselves see some exciting things happening in this area, and I think it's particularly timely for chronic disease management to explore and evaluate some of these emerging technologies. The second area where there's tremendous amount of interest because of the goal for more individualized patient-centered care, personalized medicine, and so on, is really a new generation of health professional and decision support tools that will enable this individualized care. So they could include things like patient profiling featuring predictive models that estimate individualized risk, benefit, and preferred treatment options. They could include ranking sets of treatment options by risk, benefit, and preferences that patients may have in cases where they have multiple conditions to facilitate decision making. It could include sort of the use of triage, electronic triage models, e-consultation, e-expert advice in situations where it's complex decision making and individualized treatment recommendations are being solicited. So I think is to provide a new generation of tools that will capitalize on both the data available and also the capacity to use that data to really personalize care for individual patients in a much more accessible way than is present right now. The third area of interest is in the timely detection and intervention, so new tools for monitoring population health and health system performance. Lots of exciting things in this area that I think would benefit from more rigorous comparative evaluation. So examples are, things like dashboards for health system and health system performance monitoring that take advantage of the analysis, real-time analysis or semi-real-time of data, incorporating new sources of data such as social media into monitoring patient population health status, including advanced predictive modeling that are present already to generate population level alerts for new problems that are emerging in the population, particularly in relationship to things like infectious disease outbreaks and so on. So here is just an example that we posted here from John Brownstein's Health Map, which just is one example of the very creative things that Canadians are. Yeah. The next area is integrated solutions to support the continuum of care. This would be delightful if we could see some of these in this initiative. It may be a bit too ambitious, but we are aware that some things are out and on the ground already and are trying to link together these components of both patient self-management linked to the provider team and individualized decision support, taking advantage of both patient streams of information and provider streams of information, and then bringing that up to a population-based level of care for monitoring both of these sources of information for providing more population-level alerts. So very interesting things are emerging both in the infectious disease outbreak area, at the patient-provider population level, as well as in pharmacosurveillance, but we think this is a ripe area for pursuing a lot of interesting areas, things for innovative integration. And the final and fifth area is mechanisms of strengthening accountability and improving equitable access. So the areas that would be covered here are to test technology integration to improve service medication and health professional resource allocation, for example. So this is mining the big data that's available, methodologies to facilitate access. So a lot of the whole mHealth or mobile health movement has been in innovating in very interesting ways to improve access, particularly in populations that would normally be accessing care in a timely way. And finally, to integrate information technology solutions into governance processes so that communities can hold healthcare systems accountable to deliver necessary service, so providing community access or public access to these kinds of tools. So I'm sure your question is, well, how much is available? And this is important for us to be able to communicate to you. So each catalyst is a maximum of $100,000 each. Our institute is putting in $600,000 into this initiative. Already committed, $400,000 is coming from the Institute of Aging to focus on optimizing population health and wellness over the trajectory of aging and addressing the complex health challenges of older adults. And $100,000 has been put aside for RDRC for relevant applications where the focus is on research in low and middle income countries on the questions of improving equitable access to primary health care and enabling state policies on the prevention of non-communicable diseases. So I have to say at this point this is the minimum that's available. There may be additional funds coming forward, but this is what is present on the plate at this point in time. So what about industry partnerships and partnership opportunities? So this is not a requirement of the funding competition, but we are definitely trying to encourage industry partnerships. They provide opportunities for additional research support, including funding, both in-kind and cash, testing of existing, especially new prototypes that are developed or could be integrated and deployed, could provide research infrastructure and capacity, and of course, commercialization potential. We know that some of you may not be that familiar with the industries or want to have the opportunity of contacting them. We've identified a couple of resources for people who are interested in getting more information about what industries might be interested or have technologies that may be available in certain areas of your own or your own personal area of research. So MEDIC is one. The National Association created for the Canadian medical technology industry, and our contact information at the end will provide you with their contact numbers. The other association not up here that we're just reviewing with them what kind of service they could provide to you is the Information and Technology Association of Canada, or ITAC. So they have been a part of our advisory group, as has MEDIC, in developing this whole suite of initiatives. So questions that have been asked in this area is what advice you have to partner effectively, and I think these organizations and our contact people that we'll have at the end can offer advice in this regard. Is there a policy on co-funding larger projects, for example? We'd imagine that in some of these initiatives that there are maybe jointly through industry and ministry, and this would add a very important evaluative component to that. Others may be things that are to be launched or could be launched and could be done in partnership with industry. So we are encouraging people to take advantage of things that are already on the ground where you can add a very important element to that. Other questions that have been raised is, must industry-based partners be Canadian companies? And the answer to that is no. We're wanting people to pursue what they think is the most interesting and innovative partner that would tackle an important problem in their area. Is it a requirement that the work that is funded through this be commercialized? No, absolutely not. And it's probably unlikely that through this initial initiative that new things would be commercialized. They may be get on track to go down that pathway, but this isn't a requirement. Are there expectations of the contributions that partners can make? Partners typically in this situation will be making in-kind contributions. They may also be making cash contributions, and both are to be encouraged. I think if you're wanting to set up a partnership, I think you want to know that the partner's on board with you in a joint way. And finally, will designs other than contemporaneously controlled or randomized evaluation be considered? Absolutely. I think the key issue here is that the objectives are to look at the comparative cost and quality of new solutions so that we can provide better information to support policy change in terms of that would lend to more expedient adoption of effective solutions. So the next question, or the next area we want to cover is what are the eligibility criteria? We are doing this jointly with IDRC, and so there are different eligibility CIHR and IDRC. So for CIHR, the nominative principal applicant must be an independent researcher at an eligible institution, this meaning Canadian institution, apply to CIHR-related initiatives in funding. For IDRC, the nominated principal applicant must be from a low to middle income country. In addition to these eligibility criteria, one project participant must be an end user, meaning a collaborator on the team. That could be a patient, a caregiver, a clinician, a health manager, a public health officer, for example. And in terms of questions that have been asked here, can international students pursuing doctoral studies in Canada apply? The answer is, well, no, because that you wouldn't be eligible as a CIHR or an IDRC applicant. Do we need to have a health professional to be on the application team? It would be surprising if one wasn't involved at least as a collaborator, because you would be doing really in the field probably evaluation. And so either as an end user or as a collaborator on the team. So it would be a bit surprising if you didn't see a health professional of some sort on the team. What is the ability to work in low-income settings outside of Canada? This can occur under IDRC's application criteria, having a nominated principal applicant from a lower middle-income country. Will international projects be considered? And under what circumstances? Yes, actually, international projects will be considered, and actually are almost a requirement for IDRC requirements. However, international projects can also be submitted from the CIHR component of this initiative, and they are certainly welcome. It's just that in this particular instance, the nominal principal applicant would need to fulfill the criteria also for the CIHR as well as the if they want to submit under those conditions. Okay, so next on to the review process. So the Institute for Health Services and Policy Research will review all applications for relevance to one of the 5 noted areas. Applications need to be deemed relevant to at least one of these areas to move on to the next stage of peer review. Applicants will be informed that their applications have been withdrawn from the relevant. What I strongly suggest people do is they indicate in the 5 pages, have a little subtitle that says it's relevant to these particular thematic areas that are being targeted by this application. That way there's no confusion. If it's buried in the sort of verbiage, there may be some inadvertent misclassification as being irrelevant when it really is relevant. So I would strongly suggest that you highlight this and how it's relevant to each application. The peer review process is very much like any peer review process for a strategic competition at CIHR. Full applications. The committee will be created specifically for this funding opportunity, and the committee members will be selected based on suggestions from institute, branches, partners, and our International Advisory Committee. We are hoping that a significant proportion of the review team will location so that we don't run into problems of extensive conflict of interest that leads people to have to leave the room and leaving very few people in the room to review the applications. The next thing, if you're not that familiar with the peer review rating scale that's used by CIHR, applications are rated on a scale of 0 to 4.9. Outstanding applications are between 4.5, excellent between 4 and 4.4, very good 3.5 to 3.9. Anything that's rated below 3.5 will not be funded. Even if there were money left over, they would not be funded. I don't think there's ever been an occasion that I can remember where things were, we left money on the table, that things weren't funded. But just to let you know that if the application rating falls below 3.5, that it would be considered not fundable. So obviously the next question is, what are the review criteria? So I'm just walking through these. So the reviewer to rate the extent to which the proposal addresses the one of the 5 criteria that are outlined in the application. So it needs to address only one well. It could address more than one, but there's not necessarily any greater brownie points for addressing more than one. It needs to be something that's exciting and does address something that's highly relevant to that area, and you can show that potentially it could actually make a difference. So this would be exciting for people, so I'd focus on that. So the next, or the third, is the potential of the project and the applicants to augment, integrate, and evaluate these approaches and add value to existing program processes or service delivery. I think it would be important for you to make the case that this particular integrated solution or solution in one of these 5 areas or more than one, actually in your mind convincingly probably could improve quality, could improve cost effectiveness, could improve access. I think you need to make that case because there's a limited amount of money and you really want to put your money in a basket that says this probably could be a winning solution. Or it's something that if we adopt it prematurely, it could cost us opportunity costs, enormous amount of money put in this area where it may not work at all, and we avoid opportunities to invest in other things that may be more useful. So both of these, I think, could be convincing arguments could be made that this research is important because it's going to address these issues. The fourth is the extent to which the innovation is likely to improve quality, and I think this just elaborates on the point I just made, is that you need to make the case that it could improve quality, increase efficiency, expand access. The extent to which the proposal includes innovative partnerships with industry is also going to be one of the criteria that's evaluated. As I say, it's not a requirement, but it will be one of the 5 evaluated. So to the extent that you can actually develop these partnerships, it's strongly to be encouraged, not just for this initiative, but going forth for the whole family of funding opportunities going forward. And 6 is the extent to which the end user requirements and preferences are integrated into the development and evaluation is very important for evaluating things that matter to end users, and ultimately they are the ones that will ultimately use these applications, and so what matters to them will matter in the evaluation, and that's why that's there. In terms of are there specific budget requirements, other than the fact that within the $100,000 maximum budget, there are no specific budget requirements. You need to justify the elements of the budget, and the CIHR website includes information about all the eligible costs, which are fairly standard for all CIHR. Of that. So there are some important dates that you need to consider. The application is due October 15th, so we're now in mid-August. This is a 5-page application, so it's not tremendously onerous, but this is the deadline for that application. The actual window or the ResearchNet closes at 8 p.m. Please don't try to submit your application at 7:59, having been to your health, and you may miss it because everybody else will be doing the same thing, and your computer will freeze and all hell will break loose and you'll be very stressed. So I would at least try to get your application submitted by 7 p.m. of that day to avoid all that angst and agony. The funding start date would be March 1st, so the peer review will be done in the months that follow the submission date. And we anticipate that the notice of decision will be March 15th, meaning that you will be notified that whether you've been funded or not on that date. So you may have questions that aren't going to even be answered in this webinar, and I want to alert you to these are the people that you can contact. The details of the funding opportunity are up on the CIHR website, but you may use that, and we're pleased to answer each and every one of them. To be a success story for Canada and for CIHR, we want to actually support the most applications that could possibly be funded, and so we're here to answer your questions and your concerns. So Cecilia Van Egmond is Ottawa-based, and this is her email. Kate Wood is Montreal-based, and this is her email. And Jeff Warren is the CIHR person in charge of running the competition, and that's his email. So all of us are at your disposal to address your questions. Vis-a-vis technical support for ResearchNet, just to alert you in case you do have one of those hysterical moments when things aren't working at the last final hour, this is the urgent numbers to call. And just to put a little bit, remember, all tasks must be listed as complete to be allowed to submit the full application successfully through ResearchNet. Incomplete application accepted. As I mentioned, again, the cutoff is 8 p.m. and contact CIHR if you have any questions. Just to highlight, applications need to demonstrate clear research questions and objectives, include meaningful knowledge user involvement, describe a clearly specified research methodology, are supported by a team of high caliber researchers with expertise relevant to the proposed subject, and exhibit a high degree of potential impact for the expected project's results that are transferable and generalizable. So now we're on to questions and answers. So please type them in the chat box in the bottom right hand of your screen. We're happy to answer questions in English or in French. Nous sommes heureux de répondre aux questions en anglais et en français. So go for the top people, and we'll just have a brief pause while we look at the first question to be asked. And I'm going to ask also my co-collaborators on this call, Fernando Santiago and Mary Fraser Valquette, to also be able to respond to these questions. So I have one question from Sandra Reagan. The funding opportunity details state, specifically this catalyst will support contemporaneously controlled randomized evaluation of eHealth implementation. Can you explain what you mean by this? Wanting to look at sort of down the pike implementation evaluation end of the spectrum. We're focusing on things that matter to policymakers. They want to know basically whether or not the cost, the comparative cost of actually new eHealth solutions, integrated solutions, is going to be equal to, less costly, or more costly than care on the ground as we speak today, and whether it improves quality in any one or more of the dimensions that we've outlined. So that does infer that there is some sort of comparison here, a comparison between what's usual care, because they have to make these kinds of policy decisions, whether at level or even a hospital level, community center level. They need to make these decisions. They need to decide how to make their investments. So probably is going to be beneficial in that answering that kind of a question. It doesn't have to be randomized. We recognize that that's not possible in certain circumstances. Contemporaneously means you're comparing at the usual same time. Comparison to historical has its own, as everybody's aware, each design has its own limitations and assets. But the idea behind this is to say, you know, we want questions of comparative cost and quality to be addressed by the teams that are putting forth really interesting integrated solutions. And there are a number of different ways of doing that. We only put suggestions as to what that might look like. It is not the only design, as I've mentioned. Other questions that are coming forward? I'm sorry I missed the part which mentions other ways to apply for international projects owing to poor connectivity. May I request a bit of clarification on that latter? Okay, so I'm going to ask Fernando to also be responding this question because Fernando's from IDRC and he's the key player from IDRC in supporting this initiative and addressing these issues. So we have IDRC as a partner with CIHR on this eHealth Catalyst. For IDRC, the requirement is that the nominated principal applicant be from a lower middle income country. And ideally the work is taking place in a lower middle income country. For CIHR does support research outside of Canada, so in any other international sphere, whether it's Europe, lower middle income countries, or whatever. The condition for CIHR is a bit different than IDRC. For CIHR, the nominated to be from a Canadian-based institution that's recognized by CIHR. So a team that wants to do international work, you know, would ideally want to bring on board to provide an opportunity for them to apply to both streams, both IDRC and CIHR, have a person on the team that would be eligible for CIHR as a nominated principal applicant and would also be eligible for IDRC as a nominated principal applicant. So in discussing how can you actually make sure that you have your eggs in all the baskets, you know, the practical thing we're going to have to do, and sorry for the awkwardness of this solution, is that you take your proposal and you would submit it first with the nominated principal applicant fitting the IDRC criteria, so that it would fulfill that criteria, and then you would take the same proposal and you would submit it with a different nominated principal applicant that would meet the CIHR requirements, and alert the staff, meaning Kate, Cecilia, that this is what you're doing, so that we understand what the process is. So it's a bit awkward, apologies for that, but this is a mechanism that would increase your chances of being funded, particularly if you're doing work in a lower middle income country. So I want to ask Fernando whether or not he has any other advice on this matter. Is he available to speak? Fernando?
Yes, can you hear me?
I can hear you.
Yeah, okay. Well, yes, as you mentioned, in the interest of the IDRC is to focus on developing countries, and as you indicated, we prefer applications that are coming from people who are nationals of a developing country, and the definitions on that you can find on our website. And there are some restrictions already explained very clearly in the call for proposals. That person needs to be also from an organization that is legally recognized to work in a developing country. So we really, as you indicated, we don't have any problems having teams that combine people from developing country with some people from Canada or elsewhere in the developing countries, but the principal applicant should be the researcher or the individual from the developing world. So that really is the main requirement. I mean, as you indicated, there's option to sort of go around that issue for people who might want to have a chance from other countries, but from outside, we would really like to see the work being real on developing countries by some organization and people who are in that part of the world. I hope that clarifies a bit more what you say.
Thanks very much, Fernando. That's terrific. Okay, there are a few other questions. One question is, can industry include small businesses, for example, related to e-technology development? And the answer is absolutely. So an industry can be a micro-industry, which I gather from Industry Canada's definition is 4 or fewer employees. Micro, meso, macro. It can be, pardon? So I'm being tutored here as to what this is. But yes, so a small industry, a small business, absolutely, for sure, can fit in, or a big business. Number 2, can any development costs for products being evaluated include in the budget? I think there, especially if you're going for something like integrating multiple solutions together to provide a self-management suite, or for example, you're integrating solutions together to support care along the continuum. There may be interfacing development costs along that line that would be eligible. You would need to justify those carefully. And of course, it would be that would be very foolish, because the target of this is not development of new things; it's on evaluating or integrating and evaluating things that already exist. So I think you need to use your judgment on that, because you need to understand the particular objectives of this initiative and do so and develop the budget and do your proposal accordingly. Related question is the funding opportunity targeted to the development of the technology or to evaluating the impact cost effectiveness of a technology that's already developed? I think this question has really been answered already by my previous answer. So it is targeting the evaluation impact cost effectiveness of the technology that's already developed, but it's fully understood that there are a lot of technologies out there that may not be integrated into a solution that can support someone, let's say, managing their heart disease and their diabetes and their asthma at home, or they're not supporting linking patient self-management to the care team and using that to monitor in general what's happening in the population. So there's lots of opportunity, I think, for innovation in terms of integrating existing solutions, and that would be considered to be in scope for this opportunity, as long as it meets the goal of evaluating the comparative cost and quality of the solutions. I figure for those people who have developed partnerships that will allow them to do that, plus the evaluation, you know, they can potentially accommodate it within the context of this initiative. But stretch that's available, and you might want to delay that kind of initiative until the future family funding opportunity, a larger set of funding. The next question is, can a business partner also be a researcher? For example, a researcher who runs a business that provides current services apply, or would you need a separate PI to partner with? Well, that's an interesting question. I don't see a problem other than the reviewers themselves may wonder whether or not there would be an ability to be completely objective in this context when the PI is both the business, the developer, and the researcher. So I think this would be higher risk application in my judgment at the peer review committee level, and it would be prudent to potentially get another person on board to the team who could be a PI partner. Another question is, can the eHealth innovation be a new program that is in the very early stages, or is it preferred that is an existing established innovation? I think this needs to be at the judgment of the applicant. There can be new eHealth innovations that can get on the ground quite quickly by the nature of the eHealth innovation, and could be used, and where this catalyst could be used to evaluate comparative cost and quality, especially for short-term, rapid, improved access very quickly for a disenfranchised population, where there's a quick outcome, you know, for things that are quite acute with a highly fragile population. Outcomes happen really very quickly, and those kinds of things, in fact, you can actually do a fairly, it's not you're waiting years for the outcome to occur. It happens very rapidly, depending upon the outcome you pick. So it's really hard to answer this question completely directly. I would not like to see new eHealth innovations ruled out from this program. They don't have to be established, but you need to be conscious you have a year of funding. You have $100,000, so it's what can you do that would be address the objectives of the initiative within that budget and within that time window. Okay, so a follow-up question, it seems. Okay, so to be clear, comma, then, ... would evaluating an existing intervention, but in an E format, meet criteria for this competition? For example, to improve the continuum of care. I think the answer to that is yes, that if you are taking an existing intervention and you are what I'd say IT or E format enabling certain components of that, that could convincingly improve the efficiency or the quality or the usability or something along that line, or reduce the cost while maintaining the same quality, then that would definitely be in scope for this kind of initiative. So the next question is, what can MEDEC provide as guidance of industry partners? So we have two associations. One is MEDEC, which is really the association that is the Business Advocacy Association for the medical technology industry. That's who its members are. And so if you're thinking of a medical technology, this is the organization that you can chat to. And if you're wondering who's doing work in this area or who would have devices in this area that I want to incorporate into some solutions, they would be the people to contact. The other contact, which we'll make available through an FAQ document from this meeting, is the Information and Technology Association of Canada. That is the member organization supporting the industries, many of whom have interest, applications, and involvement in a fairly major way in the area. And I think both of these organizations act as sort of business advocacy organizations. They'll know what their members are doing. They'll know who's out where and doing what, and connect to help you identify contacts that may be of interest to you. We would appreciate from you, actually, guidance on how we can help you improve opportunities for connecting with the industry. We're very keen on helping you do this. We're keen on funding opportunities that will allow you to engage with the industry or set up opportunities with universities and so on to do so. So we're looking for suggestions as well. Another question is, I'm wondering if expanding an existing intervention can be part of the budget. Can it be allocated to first assessing the feasibility or readiness to adopt e-health innovations among users prior to attempting to quality the intervention? Okay, so I just want to focus on, you know, what the policy people have been telling us is they really don't have very good evaluation of comparative cost and quality for new solutions. So this is at really the border here. I think what this person is asking, if I can read a little bit into the question, is I want to assess the feasibility or readiness to even adopt this before I bother assessing whether or not it improves quality. And I think that that is an important thing to do. I'm not sure if you did that and that alone, it wouldn't really meet the objectives of this because you're not assessing comparative quality, you're not assessing comparative cost. So it would have fit into our previous eCatalyst, but this particular eCatalyst, we're pushing out to try to get more rigorous evaluation, new and up-and-coming things that are happening or in place or are going to be in place. And so I think just looking at readiness to adopt would really not be congruent with the objectives of this initiative. But keep yourself posted if that's where you want to focus for the next family of funding opportunities where this would be a core ceiling, because I think it's an important issue. Okay, so we have another question. Let me see if I can just try to say this question. If there are program dollars in place by Health Canada, IRAP, and others, which if funding the solution was saying that the solution development money is in place, and this opportunity is doing the evaluation impact policy applications, also leverage provincial and operational groups seen as a benefit. So yeah, this is kind of the ideal solution where you've got a funder who's already funding the solution. And this catalyst would be a way of adding evaluation onto this, where you're doing comparative cost and quality. That would be certainly something that this competition would be supportive of. Don't forget that you would need to also say that this, you know, you're going to have to make the compelling case, because there may be others who are also doing the same thing, that in fact there's a good chance that this thing will make a difference, there's a good chance it will have an impact, and therefore it's worthy of evaluating. Or you could be the contrarians to say there's going to be a huge waste of money, it's probably not going to work, it's not going to be adopted, and we should cut this thing short. And that would be another way of going with this initiative. So we're just checking to see if there are any other questions. And if there aren't, then I'm just going to give our two colleagues that are on Fernando and Marie, Michelle, an opportunity to comment any other comments they have that will help you as applicants. Hopefully you will be applicants. You know, create the best application possible. Other questions? So I'll just, well, we're just pausing to see if there are any coming in. I'll turn it over to, first of all, Mary, Franco-Balquette, to determine whether or not, Mary, do you have anything else you'd like to add?
Hi, everybody. Thanks for participating in this webinar. I don't have anything else to add other than to say, please read the funding opportunity when you're submitting your application. It's very, very important.
Thank you very much, Mary. If I could ask Fernando if you have any additional words.
Thanks. Well, just to follow up on the earlier discussion, and if people start wondering if they need to have a partner from Canada or developed, that's not really the case. We would actually prefer partners that involve South-South, very collaborations. But other than that, I think the call is clear. And so, I mean, maybe questions will come later, but I think you can channel those to me. But other than that, I think that's from my side for the moment. Thank you.
Fernando, can you just ask one question, answer one question that has come up? And the question is, are some countries barred from applying? Or I guess that would be, are applicants from some countries barred from applying? Would you mind responding to that question?
I think the call anticipates that India and China are not eligible, but other than that, and if the question is the one I see here about Latin America, no, I don't think there is any particular constraint. I mean, there's also, I think the IDSC website has information on the list of countries that are eligible, and sometimes what we do is just really try to assess pertinence based on the projects, and you know, we have to comply with things like Canadian law and that, but that's really difficult for me to answer now. It has to be maybe based on exactly the merits of the program. We will have to assess risk or whatever pertinence that, but not that I'm aware of any other reason.
Okay, so I suggest that the person who posed that question send you an email, Fernando, to ask you specifically about the country in question, so that they would get the answer to that. So if you have any questions about eligibility vis-a-vis the country you're coming from, please email Fernando.
Yes.
Thanks. And then finally, I wanted to ask Michelle Peel, who's on the call. She's the representative from the Institute for Aging, whether there's any additional information, tips, or whatever that she'd like to share from the Institute of Aging.
Sure, thank you. Well, we're really excited to be partnering on this, so that's great that there's so much interest in the webinar. And in terms of the Institute of Aging, we will really be looking in the relevancy section to make sure that is clear about the relevance to the aging population and what we're interested in. So I encourage you, if you're looking to target Institute of Aging funds, to be clear in the relevancy section of the application about how it's aligned with what the Institute is looking for as described in the funding opportunity.
Thanks so much, Michelle. And that information is in the funding opportunity, what the Institute of Aging is interested in. And if you have any questions, I'm sure that Kate can forward them to Michelle, contact Michelle to discuss them. Okay, so is there any benefit from current Health Canada project lead group to understand how this could support their current efforts? I would encourage Health Canada leads to contact Kate, Cecilia, and Jeff to explore how this might be of interest, particularly in partnering with researchers in various initiatives that are underway that would be easily targeted by this initiative. And I think that seems to be the end of the questions, at least at the moment. I just wanted to thank you very much for participating today. Please take a moment to answer our short poll. We do this because we're trying to improve the webinars and the kind of information we get out to you to support your applications for new funding opportunities. So the more you can tell us about how we can improve, the better. Please do send your questions, comments, and recommendations for how you can partner with industry, or questions about the initiative, and anything that may come to mind that you wonder about, that would lead you to go down one path or not in this application. Please do contact us should you need any help in answering those questions or guidance. We very much look forward and hope that, in fact, everyone on this call will be applying. So exciting opportunity, and please stay tuned, as this is really the first step in a multi-level step of engagement in the e-health area for CIHR. So thank you very much, everybody, and have a great day.
you want to say?
Which one was the last? You weren't on the call last year. It was
Really?
Catherine, Andrew, Clay, Lori, and I.
Oh.
Yeah. And you know, we.
Hello, just to say bye. Thank you very much for the opportunity to join you.